Good morning. My name is Reddy, and today I will be talking about my practicum experience at the University of Southern Indiana. For this practicum, I was extensively working with the dementia competency team. Where our goal was to research current CNA, Certified Nursing Assistant curriculum on the care for dementia patients and to make changes or recommendations to the Indiana State Department of Health and how to integrate these new skill techniques into the existing curriculum. So now I will go into the objectives. So first I'm going to talk about the summary of the practicum events, then I'll talk briefly about the successes and achievements, and then lastly, the most important, which is the relevance of to public health, how the events completed, the activities completed in this practicum relate to the overall core values of public health. So the first thing that we did, first thing that was my major responsibility in this practicum was research on the current CNA curriculum, specifically how to care for dementia patients. We immediately realized that there was an extreme need for proper CNA curriculum that relates to how to care for a dementia patient, there's really a lot of lacking in this particular field. Then we developed a way to integrate what's called the positive physical approach, or PPA skills, into the existing ISDH, Indiana State Department of Health CNA curriculum. So I'll talk a little bit about what the PPA is. A very well-renowned dementia care educator and trainer, her name is Teepa Snow, has developed what's called the Positive Approach to Care, or PAC, which consists of various techniques and skills of how to interact and care for a dementia patient. And her organization, the Positive Approach to Care, has developed 12 steps, which you would use when you're interacting or caring with a dementia patient, a person living with dementia. And it's heavily focused on body language, how you approach their field of vision, things that make the overall experience more comfortable for the patient living with dementia and gives them a better quality of life. So these specific skills, these specific 12 steps, are known as PPA, or the Positive Physical Approach. So the next thing that we sought out to do was develop a knowledge and perception-based written exam to test CNA students' proficiency with PPA and knowledge of overall dementia. Going along with that, we also developed a skills assessment exam, a standardized patient encounter to test the CNA students' skills with PPA techniques. This would be an observed standardized encounter. We actually administered these exams to Twin Rivers CNA students at Washington High School, where I acted as the standardized person or resident living with dementia, and we conducted two separate scenarios, one where I was asleep and one where I was awake. The final component of this practicum was to analyze all the data that we collected to compare it to a previous 2016 cohort of Positive Approach to Care PAC graduates. These are actual trainers who have much more skills in this curriculum, more than the CNA students who only learned their skills from a trainer herself who was a graduate. So all of the statistical analyses were carried out with the statistical software SPSS and yielded some interesting results. So I'll talk a little bit about the successes and achievements that we experienced. The first major one is that we wanted a way to make revisions or amendments to the current CNA curriculum, the ISDH, or Indiana State Department of Health CNA curriculum manual. It's lacking in a lot of information regarding dementia itself, or the different types of dementia, and also there's no curriculum whatsoever regarding on how to interact or care for a patient living with dementia. So the first thing that we suggested is that this would be a way to include PPA in here for the care of dementia, but also this care technique, these skills can be used to can be standardized to any patient living in a nursing home setting. It doesn't necessarily need to be a patient living with dementia. It could be used for any encounter that you may experience while working in a nursing home. It focuses on positive body language, a positive approach that makes anyone feel stable, anyone feel secure. The second success, the second achievement, was the actual on-site assessments. We carried out the written and skills assessment, written exams and the skills assessment exams to two different groups of CNA students, one in a morning session, one in an afternoon session. It was a wonderful experience. I got to play or assume the role of the patient living with dementia, and I got to give a lot of feedback using my clinical knowledge as a physician, where I would see where they did things very well and where I could see them, having areas for improvement. So overall, it was a great experience. Allowed me to work on my communication skills, allowed me to be very professional when catering to a different audience, which are 17 and 18-year-old high school students that are technically in the CNA program. The next step was the very final component of the practicum, which was analysis of the data. I ran inter-rater reliability, which was basically a way, whenever we did the CNA skills assessment, they were graded on their ability to carry out the 12 steps. They were scored by 2 individual judges who each scored their own individual sheet and then came together to do a consensus sheet. So I suggested that we do inter-rater reliability on those first 2 individual score sheets to see what the level or degree of agreement between those 2 judges. I won't get into the details of the results too much. That is in my portfolio. But for both scenarios, awake and asleep, we had very acceptable and even excellent levels of agreement. We also did chi-square and t-test analysis to compare this cohort of CNA students with a previous cohort of 2016 participants who underwent similar assessments. We standardized the scoring techniques, recoded everything, and was able to compare the performance of the 2016 direct PAC graduates with the performance of the 2020 CNA students. So as we anticipated, the 2016 cohort of participants performed a lot better because they are actually graduate certified trainers. The 2020 CNA students were only trained by a graduated certified trainer. So the goal here is to see the level of, or the chain of education, the training, the trainer, trainee kind of situation. So there's areas for improvement, obviously. And then right where we are now and beyond my practicum involvement is the early stages of manuscript generation. We've already submitted a report summarizing all of our results, summarizing all the differences between intergroup differences amongst our CNA students, and then group differences between the CNA students and the direct PAC graduates. So we've submitted this to Teepa Snow's team. She's the head of the organization Positive Approach to Care, or PAC, who is basically the owner, for lack of a better term, of the PPA, Positive Physical Approach Protocol. So relevance of public health, I think that every core value of public health is carried out and illustrated with extreme success in regards to what we did in this practicum. The first one is assessment. We saw that there was a need for dementia care related to CNA curriculum. CNAs are certified nursing assistants. They tend to be a high element within nursing care settings, nursing home settings, and any other alternative living care arrangement for elderly populations. So there was an immense need. There's no existing CNA curriculum that focuses on the dementia care element, or the care for dementia patients. So we then developed a way to integrate the PPA into CNA curriculum, and this is a sheer example of policy development. And then the overall goal here clearly illustrates the last core function of public health, which is assurance. That's ensuring a competent CNA workforce trained in the appropriate techniques used while caring for dementia patients. I think it's also important that this research has substantial clinical implications, which is why it became quickly a significant passion of mine. And ultimately, our goal here is not just to have a competent workforce, but to have that competent workforce improve the quality of life of persons living with dementia. So at the end of the day, that's the biggest thing to me. That's what makes me have such a passion about public health, especially after completing this practicum. So I just want to thank you for your time and consideration. This practicum experience was invaluable to me. It really solidified my desire to work within the public health field and to help make changes and better our public health system. So I just want to thank everyone for their consideration. I want to thank the SGU Practicum and specifically the coordinator, Odrin Edwards, for all of the questions that I asked during the course of this practicum. And I'd like to thank the University of Southern Indiana for housing me for these more than 120 hours at this point. Thank you so much, and I hope you enjoyed this video. I'll be available for questions.